Oh God, this is the heartbeat of the community.
Built in 1994, Stop6 Clinic in Fort Worth has been a much-needed source of health care for patients in the neighborhood.
When they decided to put kind of a branch or clinic in the community, it made it much easier.
The barriers and the obstacles that we had to face just to trying to get to the main campus, this gives us a home community feeling.
This was the vision of one prominent Fort Worth native who led the charge to get a health center in the neighborhood.
Walter B. Barber was one of the board members at that time, and she was out in the community, and she really pushed for us to have a health center out here in Stop6. The clinic really means a lot. This is probably one of the only clinics out in this community that help the low-income patients that don't have insurance.
Janelle Watkins grew up in Stop6 and was a part of the management team at the clinic when the doors first opened. She now serves as practice manager and has been with JPS for 40 years.
That alone was just breathtaking, just to see this community, get the health care they needed, and for all of this to just come, a vision to come true.
Janelle is Stop6. She is Stop6 Clinic. I can't ever remember her saying no. She's worked to find a way to make it accommodating for everybody comes in the door. She has that kind of impact on the folk who come in here.
An impact that can be felt mainly because most of the staff who work at Stop6 are from the community.
If you grew up in Stop6 or you had some kind of friend or relation in Stop6, now because you have nurses that have either grown up in the area and who work here now, it makes it more passionate, makes it more relational.
And there is hope that those relationships can address the concerns with the COVID-19 vaccine.
It's been hard because a lot of our patients are afraid, to take the vaccine.
You have a lot of persons who are asking the question, the side effects, the long-term side effects. At this point, the long-term side effect is death somewhere down the road if you don't get the vaccine. And that's what we've tried to emphasize to them.
We're saying get it done, register, go online, do everything, and even if there are people who have challenges registering, we've tried to make sure through our staff at our church that people will walk them through that process so that they can get it done.
If we can convince that one person who said, I don't want to take it, I've heard all these things, if we can convince them to take that vaccine, it really makes a difference. We take it one patient at a time.